Hello, my name is Putri Indria and my lesson number is 200, and I'm going to talk about the introduction of this student project entitled Multiple Endocrinological Neoplasia Syndrome or MEN syndrome. The first thing that we will talk about is the background. Multiple endocrinological neoplasia syndrome is a malfunctioning of glands in the endocrine system. It could be 2, 3, or more glands affected. That is why this disease is very hard to diagnose and makes it even harder to treat. MEN syndrome can affect 1 out of 30,000 people in the world. That is why this disease needs more attention. The second thing that we will also discuss in this video is about the formulations of the problem. The first problem is what is MEN syndrome? The second is what is epidemiology of MEN syndrome? And the third is what is the etiology and pathogenesis of MEN syndrome? 4 is what is the classification of MEN syndrome? And 5 is what is the diagnostic criteria for MEN syndrome? 6 is what is the prognosis and complication of MEN syndrome? 7 is what is the management for MEN syndrome? The third thing that we will also talk about is the purpose of this paper. The purpose of this paper is none other than to answer the question mentioned before. And the fourth thing that we will discuss is the benefits of this paper. We as students can improve our understanding about multiple endocrinological neoplasia, and we can apply it on the clinical when we became a doctor. That's all I can say. Thank you.
Hello, my name is Mani and the last 3 digits of my name is 249. Today I'll be talking about definition, which is 2.1. Multiple endocrine neoplasia syndrome are caused by gene mutations, so they tend to run in families. Symptoms vary depending on which glands are affected. Genetic screening tests can be done to detect disease in family members of people who have multiple endocrine neoplasia syndromes. No cure is available till to date, but doctors treat the changes in each gland as they occur with surgery or high dosage drugs to control the excess hormone production. Multiple endocrine neoplasia syndrome can appear in infants and also people aged above 70. These syndromes are usually inherited. The tumors are abnormally large glands and often produce excess hormones. Although tumors or abnormal growth may occur in more than one gland at the same time, changes often occur at the same time.
Hello, my name is Mutabina Masranadika with student number 239. Now I will explain about the epidemiology of multiple endocrine neoplasia. In multiple endocrine neoplasia type 1, real cases are found with an accident rate of 0.35% with a prevalence between 0.2 to 0.02 per thousand. In the study, multiple endocrine neoplasia type 1 was shown to affect women more dominantly with a percentage of 57.8% of a total 734 patients. In men, the prevalence of pancreatic tumor is slightly higher in women, whereas thymus tumors are only found in men. Multiple endocrine neoplasia affecting all age group material has been found in children aged 5 years old. In multiple endocrine neoplasia type 2, the prevalence of all cases of multiple endocrine neoplasia type 2 worldwide is 1 in 35,000, while in United States it reached 1 in 30,000 to 50,000. That's all about the epidemiology of multiple endocrine neoplasia. Thank you.
Hello, my name is Pratista and my student number is 227. So now I'm going to explain about the etiology of MEN syndrome. MEN1 syndrome is an inherited disease that is inherited in an autosomal dominant pattern caused by mutations that deactivate the germline of the MEN1 or menin gene on chromosome 11. Mutation of the CDKN1B gene may also cause MEN1 syndrome. MEN2 syndrome is an inherited disease that is inherited in an autosomal dominant pattern caused by germline mutation from variable penetration in the proto-oncogene RET. The protein composed during RET is a tyrosine kinase receptor localized on chromosome 10q11.2. Mutation of the RET germline in MEN2 result in an increase in the function of the tyrosine kinase receptor.
Hello, my name is Shantika Aprilia Rahmawati with my student number 106. Basically, each type of MEN syndrome has its own characteristics of certain gland abnormality. In MEN type 1, when mutations inactivate both copies of MEN1 gene, menin as tumor suppressor protein will be no longer available to control and regulate cell growth and division, leading to formation of tumors characteristic of MEN1, which particularly occurs in parathyroid, pituitary, and pancreas gland. Primary hyperparathyroidism is the most common manifestation. Hyperparathyroidism in men 1 is different from non-men 1, such as earlier age at onset, involvement of multiple parathyroid glands, and high recurrence rate of hypercalcemia after parathyroidectomy. Men 1 anterior pituitary tumors most commonly secrete prolactin. Compared with non-men 1 pituitary tumors, men 1 pituitary tumors tend to be larger and more aggressive, with a high rate of infiltration of tumor cells into normal pituitary tissue. Moreover, men 1 pituitary tumors are less responsive to therapy. However, there is no specific histological difference between men 1 and non-men 1 pituitary tumors. Thus, patients may have some symptoms of hyperprolactinemia like non-men 1 pituitary tumors. Next is pancreas tumors, is second most common manifestation of men 1. Most of these tumors produce excessive amounts of hormone and are associated with distinct clinical syndromes, although some are non-functioning or non-secretory. But this is islet cell tumors encompass gastrinoma, insulinoma, glucagonoma, VIP, and PPoma. These pancreatic islet cell tumors have an earlier age at onset in patients with men 1 than in patients without men 1. Next is men type 2. It's known that there's mutation in RED, which is transmembrane proto-oncogen and responsible for men 2. Mutations in RET gene overactivate the protein signaling function, which can trigger cell growth and diffusion in the absence of signals from outside the cells. This unchecked cell diffusion can lead to the formation of tumors in endocrine glands and other tissues. There's also parathyroid hyperplasia found in men 2A but not found in men 2B, but both of them have same characteristics as the following. First is medullary thyroid carcinoma or MTC. It is calcitonin secreting tumor of the seed cells of thyroid. MTC develops in virtually all patients with M2A. It is often the first expressed abnormality with onset usually in the first two-third decade of life. In general, it is more aggressive in men 2B than men 2A. The second one is medulla of adrenal or pheochromocytoma.
Hello, my name is Dara Cynthia Augustine with my student number 069, and I would give explanation about the classification of the Mann syndrome. First of all, the Mann syndrome can be classified into 3 types. The first one is Mann 1 syndrome. Mann 1 is also known as Warmer disease, which also the most common form of Mann syndrome. Mann 1 disease is caused by Mann 1 gene mutation. This disease is characterized by combined co-occurrence of tumor in the parathyroid glands, pancreatic islet cells, and the anterior pituitary. Second one is Mann 2 syndrome, which is characterized by several tumor formation, such as adrenal, parathyroid, and thyroid, especially medullary carcinoma of the thyroid or MCT. Mann 2 disease is caused by RET or rearranged during translation gene mutation. And Mann 2 syndrome can be classified into 3 different subtypes. They are Mann 2A, Mann 2B, and FMTC. Each subtype has specific symptom which the detail can be seen in the slides, but the main symptoms of each type is the MCT or medullary carcinoma of the thyroid. The last one is Mann 4 syndrome, which is actually considered as one type of Mann 1 syndrome with no mutation of Mann 1 gene. The mutation is actually occurred in the CDNK1B gene, and the main symptom of Mann 4 is actually pretty similar with Mann 1 syndrome, which contains of parathyroid adenomas, pituitary adenomas, and pancreatic adenomas. But there are other symptoms in Mann 4 which are associated with gonadal, adrenal, and renal, and thyroid tumors that can be differentiated between the Mann 4 and the Mann 1 syndrome. So maybe that's all that I can say about the classification of the Mann syndrome. Thank you.
Hi everyone, my name is Dino Sumutama Silurino, student number 045, and I'm going to explain about the symptoms of multiple endocrine neoplasia or MEN. The symptoms are different for each type of MEN. As for MEN type 1, characterized by parathyroid tumors combined with pituitary and duodenopancreatic neuroendocrine tumors. Patients with parathyroid tumors are often asymptomatic with mild hypercalcemia. Symptomatic disease can also occur and relates to the hypercalcemia, for example, thirst, polyuria, and constipation, or other disease complication, for example, osteitis fibrosa cystica and nephrolithiasis. For MEN type 2, characterized by medullary thyroid cancer or MTC, together with pheochromocytoma, and parathyroid adenomas. MTZ is typically the first symptoms of MEN 2A disease, patient presenting with a neck mass, diarrhea, flushing. Lymph nodes and distant metastases are often visible at the presentation. Episodic sweating, palpitation, headache, and anxiety are common in MEN 2A. Well, that's all that I can explain to you. Thanks for your attention.
Good morning, doctor and friends. My name is Putu Andrea Sebastian with student number 143. So I'm going to explain about the examination of MEN syndrome. The first is the MEN 1. Due to clinical evidence based on each clinical manifestation of the specific tumor and our family history of MEN 1 associated tumor, we can check the biochemical and imaging test. For example, if we suspected the parathyroid tumor, we can check the calcium and the parathyroid hormone. And if this is confirmed, we can undergo the MEN 1 gene analysis. If negative, check for other phenocopy of MEN 1 associated gene using gene analysis. If the result for MEN 1 gene analysis or the phenocopy MEN 1 gene analysis is positive, we can confirm the diagnosis of MEN 1 syndrome. But there are three options that can confirm the diagnosis. The first is the founding of the two MEN 1 associated tumor. The second is founding of one MEN 1 associated tumor and one family history of the MEN 1 associated tumor. And the third is the MEN 1 gene mutation. The second is the examination of suspected MEN 2B or FNC. Due to clinical evidence based on each manifestation of the specific tumor and our family history of MEN 2 associated tumor, we can undergo the biochemical and imaging test based on the affected gland. For example, if the affected gland is the thyroid, we can check the calcitonin or the tumor marker called calcium embryonic antigen or CEA that can confirm the MTC or medullary thyroid carcinoma. If the biochemical is positive, we can undergo the imaging test. For example, MRI or CT scan. If this is all confirmed, we can undergo the red gene analysis, and if the results are positive, we can confirm the diagnosis of MEN 2 syndrome. The third is the examination of suspected MEN 4. MEN 4, due to clinical evidence based on each manifestation of the specific tumor and our family history of MEN 1 associated tumor, we can undergo the biochemical and imaging test. For example, if the affected gland in the pancreatic, or we can specifically call insulinoma, we can check the fasting glucose or the insulin. If the test is positive, we can undergo the CDK-N1B gene analysis, and if the results are positive, we can confirm the diagnosis of MEN 4 syndrome.
Hello, doctor and friends. My name is with last 3 digits number 021. So I'm going to explain about the prognosis and complication of MEN syndrome. As I mentioned before, MEN syndrome is a combination of symptoms leading to malfunctioning of endocrine systems, which can be classified into type 1, 2A, 2B, and 4. Even though most of these neoplasms are non-cancerous, they can cause the affected gland to increase in size and cause overactivity of the gland, leads to producing too much hormone. And the prognosis and complication of MEN 1 can be divided into endocrine tumors and cutaneous tumors. MEN 1 tumors may hypersecrete hormone, causing hypercalcemia, hyperparathyroidism, Zollinger-Ellison syndrome, hypoglycemia, amenorrhea, and acromegaly, which most deaths were related to hormone excess. Based on studies that have been concluded, thymic tumors and duodenopancreatic tumors like malignant carcinomas could increase the risk of the death. In addition, MEN 1 also cause comedic concern due to development of cutaneous tumors like angiofibromas, collagenomas, and lipomas. The next one is MEN type 2 syndrome. In MEN type 2 syndrome, patients with pheochromocytoma produce abnormal high level of epinephrine and norepinephrine, leading to high blood pressure, irregular heart rate, involuntary muscular contraction, and cardiac arrest, which can be life-threatening. And the last one is MEN 4. MEN 4 is usually benign. However, clinical manifestation like pituitary adenomas may cause suffer morbidity and mortality in secondary to excessive hormone productions. Thank you.
Hello, my name is Nanda Pramesti with student number 167, and now I'm explaining about treatment and management of multiple endocrine neoplasia type 1. The first is parathyroid tumor. Primary hyperparathyroidism is an early manifestation of MEN type 1 that is common in the third decade. Primary hyperparathyroidism is often diagnosed by performing biochemical tests which show hypercalcemia. Surgery is the treatment of choice for primary hyperparathyroidism. Nowadays, subtotal parathyroidectomy is recommended for surgery that can be performed. The second is pituitary tumor. Most men type 1 patients will develop prolactinoma, growth hormone secreting tumor, and ACTH secreting tumor. The first is prolactinoma. Dopamine agonists are the treatment options such as carbelgolin, bromocriptine, pergolide, and quanagolide. The second is growth hormone secreting tumor. The treatment that can be used is transperineal surgery is an effective option. And the third is ACTH secreting tumor. Most of the ACTH secreting tumor are associated with Cushing syndrome treatment with excision of the adenoma. Thank you.
Hello, doctors and friends. My name is Zaki Arafi Aidi with shoe number 122. So today I will explain about the treatment and management of MEN2. There are two manifestations of MEN2, which is medullary thyroid carcinoma or MTC and pheochromocytoma. The treatment of medullary thyroid carcinoma is divided into three stages. The first, patient with highest risk of aggressive MTC should be treated by total thyroidectomy with central node dissection within the first 6 months. The second one, patient with a high risk of MTC should be treated by total thyroidectomy for the age of 5. And the third one, patient with less aggressive and slowly growing MTC may be operated at a later stage. But keep in mind that all individuals who have undergone thyroidectomy need thyroid hormone replacement therapy. But autotransplantation of parathyroid tissue is not typically performed at the time of thyroidectomy unless there is evidence of hyperparathyroidism. The second one is pheochromocytoma. Pheochromocytoma main treatments are surgical intervention. However, it is associated with high rates of mortality if not properly prepared. Adequate blood pressure control is important to avoid hypertensive crisis during intraoperative handling of the tumor. Minimizing adverse effect of anesthesia and maintenance of stable BP during surgery. Maybe that's all for today. Thank you.
Hello, my name is Sarah Prabudina Sakti with the student number of 253 and I will explain about the conclusions. So MEN syndrome is a combination of symptoms leading to malfunctioning of the endocrine systems as tumors or abnormal mass developed in 2 or more endocrine glands. MEN is classified into 3 types. The first one is type 1, usually in parathyroid, pituitary, and pancreas gland, with a prevalence between 0.02 to 0.2 per thousand, also known as Wermer disease. Type 2 is thyroid cancer and adrenal gland tumor. Its prevalence of all MEN cases is characterized by several range of tumor formation classified into subtypes such as MEN2A, MEN2B, and FM2C, while the type 4 is similar with type 1, but the mutation of the gene is different. As if the treatment is given early on diagnosis, the prognosis of MENs are treatments dependent, and patients with MEN can live a normal life. Thank you.
That's all from our presentation. Thank you for your attention, and we close it with Paramasanti. Om Santi Santi Santi.